This problem that you have with men that have got irritable bowel syndrome, IBS, is not the diet, it's not this, it's not going to see somebody. That all needs to take place, but predominantly it's a lack of information, a lack of the correct knowledge, wisdom as you will, that we can be, that's given to us. And the reason for that is there's so much BS out there. There's charlatans, fake gurus, fact mixed with fiction, and I'm going to cover that today and do a little bit of myth busting. I want to help you out if you're a man and you're suffering in silence, or you've been here, there, and you've tried all this different stuff for IBS to get your symptoms under control so you can get your life back to normal. Then don't go anywhere. This is going to be a game changer for you. And speaking to you from personally, having had IBS since 2003, I'm a veteran. I contracted my IBS after a tour of Iraq. Came back and had gut issues ever since that got worse over time. About 10-11 years ago, I got all mine sorted out. Dialed them all in, fully under control. I get blips every now and again, so again, I'm totally transparent. Anyone that says to you they can cure your symptoms, they can cure your IBS is lying. There is no cure. And if anybody comes along and says you're going to get 100% symptom relief 100% of the time, which is kind of like a cure, then again, they're leading you down a false garden path, because life happens, things get in the way, and I'll explain a little bit more about that as we go on, so don't go anywhere, as to why you would get symptoms even if you understand your triggers. You're like, what? If I understand my triggers, I shouldn't get symptoms. But there is going to be occasions, and I'm going to mention that in this video. So the aim of today then is to arm you, with, as I said there, with the correct knowledge. I say knowledge, it's more wisdom because it's knowledge with experience from myself, my wife and business partner as well, Charlie Jean, who's a registered UK clinical and sports dietitian, and her specific expertise, her niche as you will, is IBS in men, and we run what we call Men's IBS Mastery, where we empower men, professional men, entrepreneurs, athletes, successful, driven men, self-development minded men, to getting the outcome, to getting it nailed so they can go on and live the best life. No matter where you are in your journey, because we're all on a journey, and in life, whether it's wealth, health, happiness, your relationship, your IBS, we're all on that journey, and we're all at different levels, we're all at varying levels. You agree with that? So we need people to help us out from time to time, whether it's a bit of advice, a bit of guidance, or like today, let's bust some myths, let's kick some of the rubbish that's out there, let's get it into touch, explain a little bit why, but more importantly what you can do about it, so you can watch this, hopefully give it some consideration with an open mind and go, yeah, actually, now I know why. No wonder I've been suffering, no wonder I've been getting symptoms, because I didn't do A, B, C or whatever. Happy with that? So I'm going to lay out some steps as well. The correct way, so wherever you are, gut issues, diagnosis, if you've been struggling, whatever, a kind of a flow chart as you will, a framework that you can use right now, as soon as you've watched this video, to action straight away and get yourself sorted out. Happy with that? Hopefully you are. If you want the outcome, if you don't want the outcome, again, no judgment, you can live your life how you want. If you're happy just kind of kicking the can down the road and grizzing it out, taking supplements, medications, trying every diet under the sun, missing gluten, missing dairy, and all, breath tests, hair tests, this, that, the other, and you've still got loads of symptoms and flare-ups, you're missing time off work, whatever, then you've got to ask yourself why. And that's the purpose of this today. I guess the title, as you will, is you've got to stop doing what's not working. So without further ado then, what do we mean by outdated stuff? When I say outdated, I don't mean there's a sell-by date on it and you've got to look at the sell-by date and it's out of date. What I mean is, it's a kind of a metaphor. So, for example, Facebook has been around, 15, 20 years? But the Facebook groups that we're all in, and we've got a Facebook group, I've been in many Facebook groups as a group expert, as a moderator. I can speak from experience from being in those groups that typically, and there's a few out there, there's one or two out there like ours where it's kind of, we pull people in by the reins as group experts, me and my wife, and really study, research the science, as you will, information before we release any posts and videos. So we make sure that we're as correct as we can be, do you know what I mean, in line with the scientific evidence that's out there. Especially my wife, being a registered dietitian, they've got a code of standards practice, as you will, to abide by. So with that in mind, when you've got these Facebook groups, you start chatting. In these groups you will have an array of people, personal trainers, you'll have nutritionists, naturopaths, maybe dietitians, you'll have, and everything in between. You've got all different types of people. I'm on about in the health industry. And everybody, every one of them thinks they're an expert and they know that they know what they're doing. Now, 80% of them haven't got a clue. And I really mean that. And I've seen it with my own eyes. I've read it, I've heard it. And the reason I say that, to back it up, is the information, the guidance that they give. People then go and try it. And you see that people haven't got the outcome. They've gone and tried it and it doesn't work. They've gone and tried something else and it hasn't worked. And sometimes it's being given by a quote-unquote expert. And they're not. They haven't got a clue. Also, the other problem that we've got is other IBS sufferers that have sorted their own IBS out. They're not a dietitian, they're not registered, they're not qualified, but they've been on their journey, sorted their IBS out, apparently. They've found what's works for them, and then they think they can change the world and help everybody. That's fantastic. But one size fits all fits nobody. And the reason I'm saying that is I really want to protect you moving forwards. If you're not bothered and you're willing to risk your health and take massive risks, maybe you're doing that already, but you've got to look after your health because there's consequences for everything. And if we're taking medications without the doctor, a proper doctor, general practitioner or a medical doctor, giving us the advice to correctly take that medication like antidepressants or a painkiller, then we're leaving ourselves wide open for something nasty happening, if not straight away, further down the line, if that makes sense. So I'm just trying to say this because I care about men that are suffering, having been there myself. It's not nice. And the world needs, I think, especially now, today in 2024, because the world's crazy, is we need robust leadership. We need people that can take a stand for humankind, I think, and try and guide them on the right path, because there's too many wrong paths. It's absolutely mental. So anyway, I'm digressing. You can see I'm obviously passionate about this. I did this video the other day, just as a side note. I did this live on YouTube and it had no sound. So if you watch that, I apologise. So when we say, like in these groups, you've got people that are just, it's like a free-for-all. And if you think back to World War One, the Great War, then the Germans were using mustard gas. And the mustard gas was released into no man's land in the trench warfare, and it was affected the eyes of the soldiers. They couldn't see, it blinded them. And then what happened is, if a few of these were all blind, they'd be grabbing each other and trying to lead each other out. They were just getting more and more into barbed wire and getting tangled, and then machine guns were gunning them down. Horrible. And the term that was used then was the blind leading the blind, because they were trying to help them to get them to safety. But as you can appreciate, they were becoming worse off, ultimately. And that's a similar thing. I use that saying as well in some of these Facebook groups and online as well. It's the blind leading the blind, and you've just got to be careful that. And it's easy to stand out once you know something. Once you know. You'll see it if you can see just people just chirping in and saying, "Oh, I did this. You want to try this?" You've got to go and speak to a health professional, because your health professional will give you the correct guidance and know, like, for example, if you've got any allergies, is that medication or that supplement going to interact or interfere with anything else that you're taking or that you've taken in the past? So there's all this to consider and more. And I'm not a doctor, guy. I'm not a doctor, but it's when you know it's common sense. You've got to look after yourself. So I'm on these tablets at the moment. I share this with you. It's minging. So if you're cringeworthy, don't listen. So I've for a while now, I've had like a fungal infection on my toenails. And you've got to get rid of it. You've got to take these tablets for 6 months. 6 months. So I'm on these meds for 6 months. Whatever. Crazy. Then the other thing, I've got my knees are battered from being in the military. I've had surgery on them both. And from time to time, I get severe pains. And I've got tramadol, really strong painkillers, prescribed by the doctor. But these were prescribed at a time before the toenail ones. Okay? So the other day I was in really bad pain, and I was reaching up to grab the tramadol, and my missus, Charlie Jean, was like, "Well, before you take them, do they interact with what you're taking already?" Oh, that's a good, didn't even think of that. I mean, no one does, do they? And after a Google search, they cause massive dramas. If you take the two together, there's horrible side effects. So I obviously didn't take the tramadol. I was allowed to take paracetamol, not strong, but So I went with that. Do you see what I mean? So you've got to check what's going on left and right of arc. So there's that one as a side note. Now, when we say outdated stuff, we've mentioned, the chats in groups. Some of them are good. We need, commiseration likes commiseration. It is nice to go in there and say, I'm in pieces, I'm having a really bad day, and people lifting up and supporting you. I think it's brilliant for that, absolutely brilliant. But certainly getting medical or professional advice, health advice, big no-no. And if you can do what you want, but you can leave yourself wide open. It's not the way. I'm going to come on to the way in a second, and it's easy. It's so simple, but people don't do it. Maybe because they don't know. And the purpose of this is to educate people so you do know what you're doing to protect yourself and get the outcome as quickly and as safely as possible. Now, you've got to find that, the sweet spot, as you will, from all the old stuff and the myths that are out there. Things, people saying they can do this and they can do that, try this diet, try that diet. There's loads of diets. There's thousands of diets and even more variations. So, obviously, if you've got an intolerance and you've been correctly diagnosed and tested by a doctor, a proper doctor, for that intolerance, then that can be a part of it as well, and that's going to be managed as well. Also, to consider if you've got IBS, you can have other issues as well, which is going to lead into what I'm going to talk about the flow chart in a second. If you've got something, for example, you might have diverticulitis, you might be having checks still or investigations, you might have polyps, I had a bacterial infection in my upper tract or stomach last summer, where I thought I had flipping bowel cancer. I was bleeding and everything from my bum, and dark tarry stool. So all these alarm bells were there for bowel cancer or colon cancer, and I was straight to the doctors. I don't mess around, straight to blood tests. Let's get that ruled out. And because my IBS symptoms were under control 99% of the time, I was able to identify those other issues straight away and go ahead and get them checked. As if my IBS was out of control, like yours probably is, all the time, I might not have picked up on the other issues. Do you see where this could be a drama? And then gone to the doctors. And had that have then been the worst case, I might have missed it. So this is how important it is to get, as well as everything else, for getting your IBS under control so that you can identify anything else further down the line if anything happens. See what I'm saying? And hopefully that makes sense. What does work then? We've got all this outdated stuff. When we say Facebook groups, there's people out there doing stuff that just doesn't work. Supplements, people take supplements, they believe, well, I need to take probiotics, prebiotics, I need to miss gluten out, I need to not have dairy, because people are talking about lactose on the Facebook group, or Bill at work doesn't eat bread or pasta. Do you know what I mean? And before you know it, I spoke to people in the past that are living a gluten-free lifestyle and spending $600-700 a month easily on gluten-free products. And then when we've worked with them and we've identified their triggers, what is actually their triggers for their symptoms specifically for them, it's not even gluten. They can eat gluten. And I'm like, well, do you like gluten? If you're not eating because you don't like, some people don't like bread. There is some people out there apparently that don't like bread. Strange. Only joking. But I love bread. But no, they were saying I like bread, I like pasta, I like rice. Well, you don't need to miss that out. But again, when we don't have that correct guidance and that correct trigger identification, it's just like throwing jelly at the wall and hoping it sticks, just fall off. It's difficult. It's stabbing in the dark, isn't it? And all the different things out there. The other thing as well is relying on future stuff, is going to people and for example, I don't want to pick on professions or specifically name anyone because it's bad karma, but there's certain people out there, we'll say, that just make stuff up. They mix fact with fiction, which is I think is even scarier because it's more believable. And what do I mean by that is they mix things in that do work, one or two things, in the process I'll mention in a minute, and then they come up with other rubbish. Like, for example, you need to take these supplements, and when I work with you, or if I've got these supplements, you can pay $35 a week or a month or whatever, $600 subscription, and you don't even need them. Crazy. So you're like a walking cash machine, paying this person or this company for all these supplements, or that you don't even need. It's mad, isn't it? And month by month, it doesn't seem that much, but small leaks sink big ships financially. And it mounts up big time as the years go by, if you work it out. It's better just to have a one-time cost, as if you want to call it, a cost or an investment, and then get it sorted straight away. I think, if you agree. So what do we do then? So all this, it just wastes time, guys, doesn't it? It just wastes time. How many weeks? Well, years. People suffering. I was suffering for years before I got sorted, and I don't want you to suffer for years. So if you have been suffering for years, you don't need to suffer anymore. Seriously. Well, you can get to decide. 1, do I stay in suffering? Or 2, I don't want to suffer. It's up to you. And, and then the other decision to make is, do I want to change my beliefs and think about, well, nothing works for me. Nothing works. Is that true? Really? There's thousands of people out there, men and women, diagnosed with IBS that are pretty much living an IBS-free life. When I say IBS-free, they'll have symptoms from time to time. Do you know, like blips? I get blips every now and again, but it's on my terms. And that's the beauty of having what I call, and in our business, IBS mastery. Mastery. So you have mastered your triggers, any stresses, your lifestyle changes. You've created the new habits. You've created a new lifestyle that accommodates having IBS. And it's not a drama. It's not like you become a prisoner and you can't do anything and you can't eat anything because you've got IBS. It's actually the opposite. Versus not having the outcome, not having mastery, where you are a prisoner, where you are stuck at home, where you can't eat everything and you can't eat this and you can't eat that and you don't know what you're doing and flare-ups happen, you run into the toilet, you might have an accident. It's just horrific. The worst thing you can do is beat yourself up. If you've been doing what I've said isn't working, don't listen to this or watch this on YouTube and just say, oh my goodness, I feel like an idiot. It's not the case. I've been there. And listen, I have taken prebiotics, probiotics, supplements. I've been bodybuilding when I was in the army and taking supplements like protein and thinking I've got protein farts and it's just all this stuff. And then listening to other people. And I didn't even have a diagnosis for years, which is crazy. Because it could have been, like I say, could have been cancer, couldn't it? Or IBD, celiac disease, Crohn's. So there's all these things that it could have been. Thankfully not. And I'm grateful it is only just, I say only just. IBS can have it's pretty bad at times, isn't it? Not for me anymore, but in the past certainly. Been in the trenches with it, and I want for you what I've got. But listen, this is, like I say, not everybody's into self-development. They're not. In life, there's drifters, there's people that just are happy to cruise around, and it is what it is, and accept things for how they are, the average. But what's the point of being average? We only here once. We only here one time, and we're here for a good time, I think. And it's about having the best time, best life, being happy, being healthy, fit, support your family, support your community, spiritual, believe in God, all that stuff. We've got all these opportunities, and just to throw that away or have that impacted severely by IBS, really? You don't need to, but again, your choice. So let's go for it. So the first step, what do we do? First thing, we've got gut issues, you've got wind, you've got bloating, diarrhea, constipation, maybe it's mixed, maybe you get a combination of all that. Craziness going on, maybe there's nausea, sickness, feeling like all the time, tired, sleep's affected. The first thing you need to do, and hopefully if you watch this you've done it, is get a diagnosis. You must get a diagnosis. From a caring perspective, and do you know what I mean, is go and get a diagnosis. Go and get one if you've not, because, and you're watching this, you probably like, I've got one, it's fine. I'm going to mention a little bit about the diagnosis, which hopefully might help you as well if you've already got one. A couple of things to consider. If you haven't, why get don't self-diagnose. Loads of people self-diagnose. Oh, I've got wind, bloating, and I feel a bit sick from time to time, or I'm a bit constipated. I've got really bad wind. Wind's normal, by the way. Farting is normal. Maybe not all the time, like excessively. That can be a symptom. And this is not about symptoms of IBS, by the way. You can go and research that separately. We've done videos on that. But my point is, people then think I've Googled what the symptoms are for IBS. So I've got IBS. Right, I'll start trying to now Google or ask people to see where I'm going to sort IBS out. But can I ask you a question? I'll ask you a question. Let's turn the table on this away from IBS a minute. Let's say you I don't know, you go out for a run. I don't know if you're into running. If not, why not? You go out running and you fall and you smash your knee on the floor. Really bad. You smash your knee on the floor and it's in flipping, you're limping, all your kneecaps flipping hanging out, there's blood. And you bandage it, you strap it up a little bit, best you can, and you get home. When you get home, what are you going to do with that knee? You're going to sort your knee out. And then what you're going to do with your knee, you're going to go to the doctor. If it's that bad, you might have to go to accident and emergency, to A&E, and say, well, I've knocked my knee, you've got x-ray. If it's bleeding, you might need stitches. And you're going to listen to the doctor, or the nurse initially, when they triage you. You're then going to listen to the doctor, and then you're going to see if you need surgery, you might need a bit of surgery. I'll do that because I've been told to do it. Then afterwards, you're going to take whatever medication they prescribe, and then rest. And then you've got the rehabilitation phase, getting better. Maybe you need some physiotherapy, a bit of rehab, whatever that looks like, a run-walk program, and then get back to fitness. Do you see what I mean? So we follow that structured, known, scientifically backed, proven, robust system. It doesn't work for everybody. For most people, most of the time, if we follow it properly, it's going to work, innit? It's going to get us the outcome. Agreed? But yet we self-diagnose, or we try and do things ourselves, even if we've been diagnosed, but we don't do the system that we already know that works. If your child gets really sick, if you're a dad like I am, and your kid gets really, really sick, like really sick, you bundle them in the car and you go into hospital. Or you're calling out an emergency doctor, whatever that looks like. You don't just start sorting them out yourself, if it's really bad, I mean. But do you see what I'm saying? Because you don't mess around when it comes to your children. So why mess around with yourself? See what I mean? But too many people, it seems, are just trying to do their own thing with IBS, and it's crazy. Because it's a medical condition, it's health. And then people wonder why it's out of control, there's flare-ups, it's life's upside down, we can't get this sorted out ourselves. Is there any wonder you can't get it sorted out yourself when we're not qualified or trained, or, we've not been through the system, have we? Like, for example, a dietitian. I've spent years and years and years and years and tens of thousands of dollars going to various colleges and universities to get degrees, masters, potentially PhD in dietetics, in human nutrition, in nutritics, all this stuff, biology, science, blah, blah, blah. And then they've got to go and do experience on the shop floor at a hospital, and whether it's a private or a public hospital, they've got to be assessed. They've got codes of practice. And then then they get the experience, like with driving, and we get better and better. Just with the diagnosis is what type. I mentioned before IBS-C, so IBS-D, IBS mixed. There's a number of different versions, different types, and there's little tweaks that need to be done with them respectively. So it's finding out which one. And some people get confused. They think, I keep getting a runny bum. It's IBS-D. But it might not be. It could be IBS-C. It can be constipated. And just every now and again, there's it's leaking around and there's water coming out. So this is where a healthcare professional can properly do that. See what I mean? Right, done. Step one, easy, innit? It's easy, innit? It's not. I'm not saying it's just straightforward, is what I'm saying. I'm not saying it's a gift. It takes courage to go to a health professional, especially as a man. And maybe you've got a family, manager. You don't really want to tell work you're having time off. But what's worse? The pain of going and getting a diagnosis and getting yourself sorted out, or the pain of it just getting worse and worse and worse, and the consequences, and then not being able to do things later down the line. So short-term pain, long-term gain. Happy with that? Just like going to the gym, working out. So we've done that. We've found out what type it is. Step 2 is dietary interventions. Now, it's using robust, proven diets. Robust. Not stuff that's made up, not fiction, fact mixed with fiction I mentioned before. Things that have been proven scientifically, they've got data backed behind them that work for men with IBS. Is every diet going to work for you? No. It's not one fits all, fits everybody. But a health professional, like when we get clients, my wife sits down with them on a one-on-one, and then we do group calls, and it gets tailored to you. Tailored to them, because it has to be. It's not, it's not the same for everybody. Somebody could have type 2 diabetes, type 1 diabetes. You might have diverticulitis, as I said before. You might have another condition. You could have IBD, inflammatory bowel disease, and IBS. So you could have IBS and something else as well, smashed together. But they need dealing with separately, individually, not at the same time. Because everything requires its own specific, as you could appreciate, its unique system or methods, as you will, to managing it. Make sense? But then the other stuff that they don't tell you, nobody's teaching this, are they? It's wrong, isn't it? Step 3, so we've got diagnosis, we've got dietary interventions. By the way, best advice I can give myself if I went back in a time machine 20 years, and the one thing that I would have said to myself, or 2 things to have done, no regrets, but what I would do differently, get a diagnosis straight away. I waited ages, I waited years and years. Wrong on every level, and for the reasons I said before. And then the other thing I would give myself as advice is, once you've got that diagnosis, go straight to a dietitian. Find the best person, an expert that can help you with your IBS. So, because for me, time is everything. Because you don't get time back. Get money you get back. Money you get it back. I'm not saying everyone is rich, and it's not nice to lose money, but it comes back. Things, cars, TVs, computers, things come back. Things come and go, don't they? But time, once it's gone forever. And we've only got this one time, one life. So don't mess around unless you're not bothered about fritting time away. But time is everything for me. And hopefully you'll understand what I'm saying with that. Step 3, lifestyle modifications. What do we mean by lifestyle modifications? Well, stress management. Now, I want to quickly, as a side note, talk about, not a deep dive on stress. People think, and it gets too much bad media now, that stress is really bad. If you're stressed out, it's bad. It's not. We need stress, but there's good stress and there's bad stress, in my opinion. But if you've got bad stress, like chronic, there's consequences to that. And if the IBS is a side element, as you will, and is a cause of that significant stress, then there's consequences to the stress. And you can do your own research, but chronic stress is really bad. It can cause a lot of problems. It can kill people long term. Not to scare you, but if you're suffering with chronic stress, you need to please go and get help straight away, because it's horrible. So stress management, there's different things for stress management, isn't there? Breathing techniques is an easy one. They're free on YouTube, man. Yeah, some really good breathing techniques just to get your breath down, just to get your heart rate down, and just relax your body, your system. We've got yoga, we've got non-sleep deep rest, NSDR. Search it on YouTube. Andrew Huberman, Lehman, Yoga Nidra, guided. It's on YouTube, free, all free. It's mad, isn't it? So we can calm ourselves down and we can have that rest. Our lifestyle modifications. Are you regularly exercising? Because that brings stress down. Good for morale. Good, the feel-good system. And it's good for IBS as well, especially IBS-C, if constipated, get the bowels moving. And it's difficult. So if you're struggling with IBS and you can't go out and hit the road, go to the gym, maybe you've got excessive wind and you don't want to go to the gym for embarrassment, I get it. Train at home. No excuse. There's always a way for the committed. There is, but there's always an excuse for those that are not. You can train at home. I've trained before when I've been bad with IBS in the past, years gone by, in front of a TV, YouTube, yoga. Do you know what I mean? And when I had knee surgery and my knees were really bad and I was on crutches, hobbling around, part of me feeling sorry for myself, there's other things that I can do. I could maybe lie down on the floor and do some bench presses. Maybe I can just put some cushions under my knees and just do some sort of press-ups, some sort of upper body, some dumbbells. Maybe I could sit in the gym. They've got their machines and you could spin them round, can't you? Get your heart rate going, and then you see what I'm saying. So the point is, there's always something. It's having that can-do attitude. What can I do, rather than we always focus on what can't I do. I can't do this, can't do that. That's fine. You need to know what you can't do, and then think, well, flip the script. What can I do? So lifestyle changes, improve sleep. What's your sleep like? Is IBS keeping you awake? Is your sleep rubbish? So because of that, you're drinking loads of coffee throughout the day, and then the caffeine's, you can't get to sleep properly or straight away because of the caffeine. Because if you're drinking caffeine after midday, it can affect your sleep because it's still in your system. Again, do your own research on that. Do you see what I mean? So there's loads of Alcohol. What is your vice? Listen, we've all been bad with that. Most of us have been bad with alcohol at some point. Like, had a bit of a bad relationship. I had a bad relationship with it for a while in the army. And it can be a crutch. It can be a vice. Like, right, I don't drink alcohol. But it does the opposite, doesn't it? I don't drink anymore. I'm teetotal, have been for a long time. And it's been a game changer for me. And hopefully it will be for you as well. So if your sleep's getting affected, what's affecting that sleep? Do we need to then go get therapy? You see what I mean? So it's identifying bit by bit and sorting out each part, each element needs its own unique thing, as you will, to sort it out. But combined, you will end up with self-mastery. Not just IBS mastery, but self-mastery. Do you see how this is working now? It's unfolding. Nobody else has you go into the group, Facebook group, they're not telling you this. Oh, take supplements. Oh, just have some Buscopan. But it's a Band-Aid. Do you know what I mean? It's a Band-Aid. If you were to drive down the road, and if you're a good guy, you're driving down the road, and you saw a child in the side of the road bleeding to death, totally like, I don't know, being hit by a car, hit and run, and they're bleeding, their arms are all broken, but still alive. What would you do? Well, you wouldn't just drive off. So that's the first thing. But would you pull over and just say, oh, actually, I've got a medical kit in the back of my car. I'll pull it out and I'll just put some plasters and some bandages around it and I'll leave you to it. You're not here. You're going to either do one or two things, is phone emergency services, whatever that looks like, whatever country you're in, and get an ambulance there ASAP and wait with that child and support them and, you know, do what you can with them, arrest it. I'm medically trained, so I do something to stop the bleeding. But even if you just stay with them and just keep them awake, keep them round, support them until the ambulance turns up, or you could get them in your car and take them to the hospital yourself. Do you see what I'm saying? So you wouldn't just put a Band-Aid on it. That's my point. You wouldn't just put a Band-Aid on it. You get to the root cause. That child needs to go to a hospital, needs surgery, needs morphine or pain relief, needs sorting out, parents need contacting, and then it's getting to the root cause. So we've got fluid intake. We're saying lifestyle modification still. What about fluid intake? Are you drinking enough water throughout the day, or water? Food can have water in it, like salad and vegetables and stuff. So are you having enough fluid throughout the day? What is your fluid intake? What are your requirements? Is it 2 litres? Is it 3? Is it 4 litres? It depends on it. What exercises are you doing? What fitness? What's your work look like? How much do you sweat? So all this, again, healthcare professional, we help our clients with all this out. You see? So you get the whole thing. And then with step 4, so with diagnosis, we've mentioned diagnosis and classification. We have talked about dietary interventions. We have talked about lifestyle modifications. The 4th one we look at is any medications required. Can we look at medications? Not from Peter, Bill and Pat and Sue in the Facebook group, and not from some charlatan online or whatever, unless you want to, obviously, and take that risk off our doctor, you know. So we've got, you know, for example, when my wife works with clients, if throughout the process of working together, she identifies, she can't recommend medications, obviously, she's not a doctor, but she could suggest, look, I feel that you need to go and speak to your medical doctor and mention this, and this to them, and you may get A, B, and C. Happy with that? Doctor. So medications only that are prescribed and recommended by a proper doctor, MD, GP. And then at the end of the day, you've heard about the gut-brain axis. Well, do we need gut-targeted hypnotherapy? Do you need cognitive behaviour therapy, CBT? So these things may be required and could help you as well, like take that leap forward to get the outcome. It sounds complicated. Listen, I don't want to overcomplicate things. The last one, if there was a 6, it would be education. We are here, I believe, on this earth to help each other. We're here to help each other. If we've got wisdom, we've got to share it. The Bible says it. I'm religious. If you're not, it doesn't matter. But if we've got things to share, we need to share it. But when you mix that knowledge with experience, then you smash them two together, you get wisdom. Wisdom is the superpower. Wisdom is where it's at. That's where it's at, guys. Wisdom. And you can only find out through failing. But remember, there is no failing. We fail forward. Yeah. So we either learn or we succeed. And we try and progress, we develop self-development, making ourselves slightly better each day moving forwards. And remember, some people don't do any of this. A lot of men out there don't make 1% improvement at all. But if you make 1% improvement, just 1% improvement a day, That's 365% in a year improvement. Unless it's a leap year, then we get an extra bonus day. So we get 366. Do you see what I mean? So 365% improvement. How much improvement could you make in just 3 years based on them numbers? What would your life look like in, even this time next year, looking back? If you're just focusing on each day, just doing one little bit. Each day I'm going to get a diagnosis and I'm going to listen to the doctor and do what's recommended. 1%, maybe more than 1%, yeah? Then I go and see a dietitian, or you drop me a line and we can have a chat, whatever. Join our group, Facebook group, IBS in Men, and speak to me. Glenn, what's some next steps? Whatever, it doesn't matter. But imagine that, that empowered feeling then. And then when you go and get that help and you listen to him and you be coachable and you turn up because you've made that decision as a man, put your stake in the ground and said, right, I'm going to get the best help, the best support. No matter what it costs financially, who cares about that? I'm just focusing on the outcome. I want to save time. I want to get this done quickly. I mean, we normally get our clients sorted out in 6 to 8 weeks. It could take slightly longer, depending on you specifically. It could be slightly shorter, believe it or not. It could be doing as little as 3-4 weeks. Symptoms pretty much gone. So it all depends, just to manage expectations. But just to have a marked, a big level of improvement, how good does life then become? And there is always a way for the committed. If you're committed to the outcome, there's always a way. So hopefully that's been helpful. I don't want to rattle on anymore. If you found value in this, and hopefully it has been a bit of a game changer. I wish someone had showed me a video like this when I was in the trenches with IBS, and that's the reason, as well as many, for this publication today. Give it a thumbs up. I'm not into my ego being massaged. You can probably tell by my personality on this video. I don't care, but if you just drop a comment, the algorithm in YouTube, if you're listening to this on YouTube, they'll push it in front of more men. That is my aim, and Charlie Jean's aim, is to get this message out to as many men as possible. We want to help over 1 million men, but listen, I can't do that on my own. I can only push out the content with my wife, but we're all in this together like an army. Like when I was in the military, you go to Iraq or Afghanistan or wherever you go in the military, you're a team. Everybody looks out for each other left and right. Buddy system it's called, buddy system. We can't do anything on our own. You be the best soldier, the best special forces operative in the world, but on your own in certain areas, you're dead. You've had it. You mincemeat. You need people to the left and right of you and into the rear and everywhere else as well. So if you do us a favour, you could do the biggest favour I could ask for. If you found value in this and it's hopefully helped you, for some of you, there'll be somebody who watches this, I'm telling you, and it'll change your life. And I'm not saying that because everybody says cliche now, and everyone says, oh, this is life-changing. It really will. Because if you follow that flow chart, get a notebook out and a journal, go back if you need to, skip back to that, even just go back to that bit and write them steps down and do the steps. Do them. And listen, if you're doing those steps, don't try them on your own. If you try them on your own, Glenn's full of rubbish. I tried that flow chart. I tried it all. And maybe you've tried it all anyway on your own and it hasn't worked, because hopefully I've impressed upon you enough now of needing that expert in the arena. So somebody, like what me and my wife do, can put their arm around you and be in your corner, like when you're in a boxing ring. You've got your coach and your team in the corner. That's what you need, somebody fighting your corner that knows what they're doing, and they can get you out of this mess, as you will, this muddle, as quickly as possible. Hope that helps. I wish you nothing but the best in health, wealth and happiness and success. Take care.